This is not good. Just think, guys. If the nurses are striking, then who's taking care of the patients? Blessings, blessings, and more blessings, you all. I am your host, Michelle King, and this is Soulful Nutrition and Wellness, where evolution is essential for growth. Today, I got a hot topic. I received an article or read an article from Forbes, and it is on the current nursing strike that is taking place in New York. This article was written on yesterday, or, available to us on yesterday, published January 18th. So today is the 19th. So this would actually make the 8th day of the strike. But here it states, 7th day of New York City nurses strike highlights ongoing healthcare problems. This article is written by Bruce Y. Lee, senior contributor, MD, with a MBA, and he covers health and medicine, wellness, and science. So let's just hop right into what this strike is looking like and the reasons for the strike. And man, I'm sure anyone that is a nurse or a healthcare professional can identify with this article and what it is entailing. The strike itself. So it states here that the largest nurses strike in New York City history reached its 7th day on Sunday with no clear in sight. And even if this strike at some point gets resolved, it should be yet another striking reminder that the U.S. healthcare system is like the title of that 2018 song from Lovely the Band, Broken. A broken healthcare system, in turn, is the opposite of a lovely thing for patients and the rest of society. So let's stop right there for a moment. Anyone that's been, listening to and enjoying my videos knows that I myself have worked in healthcare for over 36 years now. And this is something that has always been a concern during my stint in healthcare, is the burdensome fact that we tend to be overworked, underpaid, and unappreciated. And not so much, by our patients, but just the system itself, I would suggest. And during my time of working in healthcare and furthering my education in healthcare, you have professors during your courses that will be very honest about the fact that this system in healthcare is broken. It is fragmented. And as one of my professors said in 2013, there's no way to fix it, is what she pretty much said. And so you would think, well, you look around the classroom and there's, 30 students sitting in there furthering their education in nursing, but we're doing this going into it knowing that the system is broken and there's no means to fix it. So it doesn't surprise me that these nurses here in New York have decided to strike, especially if there is a union in place. And we'll get back to that. So the New York City nurses strike, it struck on January 12th. So it's been going on since January 12th. And there is approximately 15,000 nurses that are striking. And they're saying, I can't go for that. No can I. No can do I. They just simply cannot go for the current pay anymore, the working conditions. So they just simply walked off their job at Mount Sinai Hospital in Montefiore and New York Presbyterian Systems. Since the New York State Nurses Association, their union representing them, has been engaging in negotiations with the hospital management. The union has been arguing over pay increases and increased measures to protect the safety of nurses. After talks at the beginning of this past week, stalled like a car made out of sausage, it says here. A federal mediator joined the mix. But so far, there are no signs of an agreement, close to any agreement, it states here. And just think, guys, if the nurses are striking, then who's taking care of the patients? Who are they getting to come in and work these shifts that are around the clock, because a hospital doesn't close? And so you need someone for the day shift, midday shift, and the night shift, as they call it, the graveyard shift. And do we have enough travel nurses in place to come in and fulfill these slots that need a warm body with a RN behind their name to take care of these people that so deserve to be cared for? Have you been questioning the current status of your relationship? Does it seem as if everything is your fault and you can do nothing right? Are you binge watching YouTube videos seeking out an answer on narcissism? Well, you don't have to look any further, because I have what you need. I have written a book entitled Creepy, The Unveiling of a Narcissist, along with a journal that you could use for cathartic writing as you are reading and getting set free. The book is not dedicated to the narcissist, but the very things that you are going through as you endure this painful relationship. The book is available on Amazon and in my store, soulful-store.com, soulful-store.com, so that you can begin to heal. God bless. It says here, the nurses' strike is not surprising given ongoing burnout problem among all healthcare professionals. It didn't say some, but all healthcare professionals. So that includes not just nurses, but physicians, residents, and then even current medical students. The numbers here are showing that, let's see here, burnout is at crisis level, and 35 to 40% of nurses and physicians are experiencing burnout. 45 to 66% of medical students and residents are experiencing burnout. Now listen, if you're a medical student or a resident, you haven't even began to practice yet, meaning you've passed all your exams, you know just where you're disciplined, you know where you would want to work as far as your profession, and you haven't even graduated yet completely, and you are burnt out. And then for all of those that have been doing the job, whether it's 6 months, whether it's 25 years, are currently burnt out. What are we going to do about this madness? So speaking of burnout, I was on the job yesterday, and myself and some fellow nursemates were talking about, PTSD, post-traumatic stress disorder, and how that is not even addressed when it comes to working in the healthcare profession. We deal with patients that are not well, and perhaps some may, be well enough to return home after their hospital stay, or depending on what department you work in, the experience of, patients passing away, and then you have to absorb or, be able to deal with, or as we discussed, compartmentalize the fact that you've lost this infant after doing all that could be done to help that baby, or it doesn't even matter the age, the older patients, you lose them, and after you've provided them with CPR for however long, and perhaps you get a pulse again, but then that patient still passes away. So there can be a level of PTSD, post-traumatic stress disorder, but then you got to come in and do your job the next day as if your favorite patient that you got to know because you took care of them for 3 days, didn't just pass away. So you feel for the family members, you feel for your other co-workers. And, a lot of these reasons is why these nurses are now striking. I don't think it's just because they want attention or just because they're looking for, to match the paycheck of the executive of the hospital, but just to be fairly treated for, the profession and what it is that you do on a daily basis. The report stated that even before COVID-19 pandemic, the National Academy of Medicine found that burnout had reached crisis level among the U.S. health force. So again, this is before the start of COVID. So just imagine today here in January 2026. And here's something to pay attention to in the healthcare system, where the pay is going. Nurses going on strike in New York City have mentioned that the pay of healthcare executives at the Mount Sinai, Montefiore, and New York Presbyterian systems suggest that there are more resources available to pay nurses and other healthcare professionals more. It is believed that the monies is going more toward those that are in executive positions versus those that are actually doing the hands-on care of the patients. It says here, this pay gap between executives and healthcare professionals, the people who are actually doing the direct patient care work, isn't unique to these healthcare systems in New York City. In August 2025, they found that the average wage of chief executives rose by 27.5% from 2009 to 2023, compared to the only 9.8% rise in the average pay for all hospital employees over that same time period. There's an imbalance there, wouldn't you suggest? Again, the time and energy and effort that it takes to do your job every day as a nurse, a healthcare professional. I don't take it lightly, because like I always say, you are taking care of human beings. You are taking care of the loved ones of, the loved ones of your community, like parents, children, cousins, sisters, brothers, and it should not be taken lightly. And there now is a time where we need to begin to look into what can be revamped in the healthcare system in order to save the system right now and for what we have left. Because what happens when people begin to no longer desire to become a nurse? What happens when no one wants to do the job anymore? What happens when you have now your healthcare professionals suffering from PTSD and they are crashing and then need mental health, help themselves? So this is not good. This is not good. But I will say this. It states in this article that nurses, the actual shortage of nurses is at 8.06%. As far as, the actual shortage is 8.06%. So to me, that doesn't sound bad. You figure 100% of nurses and the shortage is 8.06%. It could be worse. On the LPN side, it's 20% short when it comes to LPNs, and then for RNs, it's 10%. So we are still getting the job done to the best of our abilities. I think that we must keep hope alive. We have to begin to come together to formulate a means to heal what is actually taking place within this system. And who better to do that than those that work within the healthcare system? We know exactly what's going on, whether we speak about things that we feel need to be, where a change needs, evolution needs to take place or not. We see exactly what goes on because we care for the patients. So I hope that this video has brought some light, shed some light on the fact that these nurses are protesting and they are unionized. But the most of us are not unionized. And so we don't protest. We don't protest because we don't have any backup. There's no backup for us. And guess what? You still gotta earn your wage so that you can stay afloat and pay your bills. So hats off to these nurses. I pray that they get totally what they're asking for and also what they deserve. And leave any comments if you have any ideas on how we can band together to begin to bring about a better healthcare system in the United States of America. I can't speak for any other country because I'm here, and I want to be of use right here in this nation to bring about a positive change for the greater good. So again, this is Soulful Nutrition and Wellness, where evolution is essential for growth. Until next time, peace out. Have you been questioning the current status of your relationship? Does it seem as if everything is your fault and you can do nothing right? Are you binge watching YouTube videos seeking out an answer on narcissism? Well, you don't have to look any further because I have what you need. I have written a book entitled Creepy, The Unveiling of a Narcissist, along with a journal that you can use for cathartic writing as you are reading and getting set free. The book is not dedicated to the narcissist, but the very things that you are going through as you endure this painful relationship. The book is available on Amazon and in my store, soulful-store.com, soulful-store.com, so that you can begin to heal. God bless.